The angle of the lateral curvature is relatively large in the lumbar region, right? Okay, you can put your right hand down. Now, use your right index finger to touch the spot I just pointed to. Okay, that's the left side. Switch to this side. All right, that's good. Now face everyone and do as I do. Right foot back, left heel touching the big toe of your right foot, hands along the seams of your pants, and then close your eyes. Just stay like that. Don't move your feet. Oh, you opened your eyes. Don't worry about what I'm doing, just focus on standing still. Right, I'm testing whether his brain knows where his spine is and where his body is positioned. He can't hold it, huh? Okay, switch feet and let me see. Right, he can't hold it at all. Normally, you need to stand for at least 30 seconds without falling to pass, at the very least. Oh, he really can't hold it at all. Are you wearing a sports bra underneath? Are you wearing a sports bra underneath? No? Then how are we supposed to let everyone see the range of motion when you bend over? Pull it tighter. Let me see if it's snug enough. Now, bring your feet closer together, closer together. And then slowly bend forward like this. Lower your head first, then arch your back, and then bend at the waist. And then come up, slowly, slowly come up. You're moving too fast, too fast. Okay, come up again, come up again. Okay, come up again. Good. From here, go down bit by bit. Slowly, slowly, go slower. Right, go down a little bit at a time. Down, 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 stop. Stop, 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 stop. Hey, okay, roughly here. Can you see that the left side is clearly higher than the right side, right? Because she isn't wearing a sports bra. I can't just take it off to show you like a guy would. So that means it's the left side. This side is overall more protruding and raised than the right side. Were you less stable when your left foot was in the back just now? It's unstable when the right side is in the back. Let's try with the left side in the back. Let me see. You can't even hold it for 3 seconds. Then put your right foot in the back. Let me see. He can't find his balance on either side. He can't find his center of gravity. So in this case, his walking isn't affected much because he's an office worker, someone who sits for long periods. His sacrum, his coccyx, his median sacral crest, and the coccyx sacrum joint are perfectly aligned, so his pelvis is actually quite straight. It's his upper body that's tilted. But while you're sitting, do you have any gastrointestinal issues or problems with your internal organs? Have you ever had persistent pain in any specific area before? You haven't had any persistent stomach pain or issues with your appendix or constant bloating. Aside from those, anything else? No. What I'm asking about is the internal organs. If there's nothing else, and it's not because of pain in a specific organ that he's trying to avoid or reduce pressure on, which would cause the scoliosis, then it means he just doesn't know where his lumbar spine is. If it were someone who, for example, has chronic stomach pain, then to make room for the stomach, I would lean towards the side that hurts. I would lean to that side, and by shortening this side, the lumbar spine would shift to the opposite side, which creates more space on this side. So some people present with this posture because a certain internal organ is constantly in pain. It's not that. It's more like they can't find their own position. All right, sit here and let me take a look, since it's mostly when sitting anyway. Okay, let's grind it again. No, you don't need to press yet. This side is positive. Okay, now go ahead and press the button. Overall, the convex side feels worse than the concave side. And this is what he did worse than when standing. So his standing test is actually more accurate than when he's sitting. This is why it's not influenced by the sacrum or pelvis. The issue is with the lumbar spine itself. That's why when he's sitting, he's relying more on the lumbar spine to adjust itself. But in the end, he just adjusts blindly. Well, he doesn't know where his position is. So, for a member like this, you need to have them sit down to train. They will have a better sense of it if they train while sitting. I'll first simply stimulate the area around his lumbar spine, and after that I'll check his range of motion when he bends forward to touch the ground, and then I'll take a look at his. Proprioception here because it involves the coronal plane, sagittal plane, and horizontal plane. So, I need to first check the angle of his horizontal plane. Put your hands on your shoulders and do a trunk rotation. Let me see. Face everyone. Let everyone see the front. Come on, turn to the left. It's more to the left, right? Yes, more to the left and less to the right. Good. Okay, put them down. Now let your hands hang naturally and lean to the right to try and touch your hip. Don't lift your sit bones off the chair. Keep them down. Just go as far as you can. That is going to be to the right. Okay, and now let's move over to the left. So it's more to the right, is that right? Yes, the lateral flexion is more to the right and the rotation is more to the left. What is your degree of myopia? 1,000 degrees? Is it 1,000 in both eyes? Has it been like this since you were little? How old were you when you started wearing glasses? 7 years old? So you didn't have it before 7, right? Actually, I had it before that too, but I didn't wear glasses. So when you started wearing glasses at 7, was it already 1,000? What was your prescription at 7? 300, 500, 600, all the way up to 1,000. How old were you when it reached 1,000? It reached 1,000 in my 20s. Let me take a look at your eyes. Yes, eyes, stare at me. Do you have astigmatism? What's the prescription for that? Is it 300 in both eyes? Hmm. Well, it's not the eyeball affecting the spine, it's the brain affecting your vision, which in turn affects the spine. Okay, so what do I do next? Then, when I guide you through this movement, it's like this. In a moment, I'll have you place your leg in this position. You shouldn't look down, you need to look straight ahead. When I tap one of your legs, you move your body and then use your finger to tap it, saying, I'm tapping here. Right, you can't look down, understand? Ah, okay, get ready. You can't tap 3 times, you have to tap it in one go, okay? Okay. All right, don't move now. I've drawn a dot here. Take a look, watch it, and then use your hand to tap it. Go back and tap it again. Good, go back and tap it again. Okay, now without looking at it, tap the spot I just taught you to tap. Good, don't move. Keep your finger still. Don't move your finger. Once you've tapped it and confirmed, don't move. Okay, now look down and see where it is. Sigh, look at it again and tap it. Right. Good, good. Now, without looking at it, tap it. Okay, that's good. That's a pass. I'm going to change the position now. Look, it's here. Tap the center of this circle while looking at it. Good, look forward. Don't look at it anymore. Don't look at it. Right, tap it. Okay, that's good. That's a pass. Look forward. Okay, that's good. You see, you really cannot draw the design directly onto the toenail itself. Instead, the toenail just serves as a helpful reference point for you to work from. The third toe. Good, don't move. That's basically fine. All right, I'm changing positions. Because there was rotation just now. This one is more about the sagittal plane. Okay, not bad. Not bad. All right, next, give me a chair. I was drawing on your leg and you could feel it. Now, I won't draw on your leg anymore. I'll draw on my own leg and you tap it. Go ahead and tap it back. Just watch it closely and then tap it again. Okay, open your eyes and take a look. Tap it again, tap it again. Okay, look forward. How did you move to that position with your eyes closed? Roughly, okay, this point is a pass. You need to sit further forward. Watch it. What I am currently training him to do is to utilize his visual memory to help his spine determine the correct position. And by doing so, we are significantly enhancing his overall spinal control. Okay, impressive. You can look forward. Look at me, look at me. I'm not drawing anymore. I've moved my leg. You keep tapping. Well, wait a second. This is 1, this is 2. And then further out, you can choose more. This is 3, and now I want you to tap 2. Look forward. Good. Open your eyes and look at it. Tap again. Go back and tap again, right? That means after you tap, your body needs to return to center and use your body. It's not about reaching with your hand. It's about using your body, using your spine. Right, just look at it and tap, use your body, then go back, use your lumbar spine to go back and tap again. Look at it and tap. Right, good. Now don't look, just tap it. What about your legs? Right, this position doesn't work. Come on, keep looking at it and tapping. Ah, this direction is its weakest point. Keep looking at it and tapping. Tap a few more times. Good. One last time. Tap again. Look, tap again. Okay, stop looking. Ah, this position is your weakest point. Hey, keep looking and tapping. Ah, which means this angle of rotation is where he feels the least aware of where it is. He hasn't gotten it right even once. Every time it's off by 10 centimeters. Okay, I'll make it a bit easier for you. I'll move it here a little. Okay, look at it. That's a bit better. Good, not bad. Hey, I'll move it in another 2 centimeters. Okay, stop looking. That's a bit better. Let's do it one more time. I suspect you were just guessing this time. Wow, I can actually feel it. Wow. Ah, now let me see the angle of your body rotating to the right. Let me see how it is. Because before, you didn't know the position of your lumbar spine in this state. So when you got there, you got stuck. So now let me take a look. And like this, your body first turns to the left. You have a very large range of motion to the left. Right, the range of motion to the left is very large. And now to the right. Okay, now this is normal. And just now he had a problem with lateral flexion to the left, right? So next I'm going to train his nerve control for lateral flexion on that left side. I need him to know where his lumbar spine is. This is for training lateral flexion. Come to this point. Open your eyes. Look, it's quite far off. Continue. This person gets lower back pain from sitting too long because their brain loses awareness of their lower back. Good, you hit the right spot this time. Once you hit it right one more time, we'll move on to the next point. That was still the right spot, not bad. Come on, I've moved this point a bit further out. Ah, this one is even further off. Come on, continue. So when they laterally flex to the left, their brain doesn't know where the position is, and when they rotate back to the right, it doesn't know either. Keep your eyes open and look at it. Right. Oh, that's right. You're just guessing, aren't you? Let's do it again. Okay, don't look. Keep pointing at it. Not looking this time. Wow, I am genuinely impressed that you actually got it right. Now let me try pointing over to the side front, and then, if you could, please point at this specific spot right here. Okay, not looking. Good. Open your eyes and look at it. Okay, not looking this time. That's right. Good. This spot. Don't press down with your whole finger. I want the pad of your finger. With your finger being that thick, one part of it is bound to hit the right spot. Right, right, exactly. Make sure you use the pad of your finger for this part. Just like that. Perfect. Okay, open your eyes and look. Let's do it again. Ah, that's right. Let's test one last time. I'm right here. This one. Oh, do it again. The same one. I want to make sure you're not just guessing. Wow, you actually got it. Let's do it one more time. I don't believe it. Oh, try leaning to the left a bit and see. Just like that, not when you were sitting just now. Hey, lean to the right and look to the right. Lean to the left again. Okay, that's good. Now, I'll change direction. I want to see if you can touch it accurately while sitting here. I want to test it again. Are those circles from just now still ready there? You can switch to this one. Sit a bit further out so you don't get stuck. That's much better, but this one is still clearly not quite right. Let me tell you why we draw circles. You see, this circle is to test whether it's the lateral flexion that's not working, or the forward bending, or the rotation. It's to train the control of that circle. Watch it first, and then when you can find the position without looking, it means it can control this area. It knows where the position is, especially for training the precise position sense of a specific segment. At first, you let it use vision to confirm, and then later you have it send that signal to the brain so the brain can judge and precisely control the angle of its spinal lateral flexion to hit that point. Okay, now let's bend forward again and let me take a look. I want to see the angle of your lumbar curvature. This is just a standard mechanism. It's not really capable of handling someone with this kind of scoliosis. Okay, come up slowly. It's much smaller now, right? Ah, good. Stand all the way up and then go down slowly again. It's much flatter compared to before, right? Okay, that's good. I originally wanted to find a way for you to walk better because its scoliosis isn't caused by an influence from the bottom up. His issue is with the lumbar spine itself. It's a disconnection between his lumbar spine and his brain, not between his lumbar spine and his feet. If it were a disconnection between the lumbar spine and the feet, I would just have him walk, and that would be much faster. Then, someone even more unique came up. This case is unconventional. You basically won't encounter this kind of thing often, so it wasn't originally within the scope of the course I'm teaching. But since he came up, well, there's nothing I can do, so you all get to learn a little bit more.